My name is Wambui Davis. I'm a consultant physician and diabetologist. I'm also a research fellow at the Center for Research and Therapeutics at Strathmore University. So today we are going to talk about diabetes generally. So watch out for the upcoming topics. Parameters that need to be monitored for every diabetic patient depends on the type of diabetes generally, but what covers for all kinds of diabetes. We'll start with what is the principle, which is monitoring of sugar. So monitoring of sugar has different ways of which they're being monitored. So there's a way in which we monitor a patient who is ongoing treatment. So there's a fasting blood sugar and there is a postprandial glucose sugar. So fasting blood sugar is between 4 and 7, that is in the morning. Postprandial glucose, which is measured 2 hours after meal, is not supposed to be above 9 millimoles per liter. Apart from that, there are other parameters depend on the type of complication that you are looking for. Generally, the basic ones is we measure what we call your atherosclerotic risk. So we are looking at your lipid profile. We are looking at your echo, your ECG, depending on how we examine you and we see the need for it. We also look at other facets, including your renal situation. So we'll measure your urea, creatinine, and electrolytes. We'll measure your albumin-creatinine ratio. The other things that we might be interested to look at is one, urinalysis. So there we are looking at if there are any complications that have set up from the kidney or the glucose control. There are other issues now that depends on the risk that you're carrying. For example, if a type 1, we might want to check for other autoimmune phenomena. So we might need to look at your thyroid, and any other autoimmune related issue that may be associated with it. Apart from that, there are other wider parameters depending on the patient that we may look at, and this include but not restricted to your liver function test for patients who have non-alcoholic fatty liver disease. We may even look at your eyes just to screen for retinopathy. We may look at your testosterone levels if it's a patient who has erectile dysfunction. We may examine your limbs to look for neuropathic issues. So a CMS Weinstein to check for the pressure on your feet, just to see how you perceive pressure. For a patient to know they're achieving their targets in diabetes management depends on, it's individualized. No one patient is the same. So once you sit down with your doctor, we'll always individualize your care depending on the risks that portend you in terms of medical risk, psychological assessment, social issues. We'll put all those into context to determine how well to manage you. So most of the time, the HbA1c target is usually 7% and below, but there are those who we go further to below 6%, 6.5%, and there are those who we have a loose kind of control at around 8%, and mostly those are the elderly with a lot of comorbidities that are attached to it. Basically, for fasting blood sugar, we target between 4 and 7 millimoles per liter, postprandial glucose excursion, just below 9. And then there are other parameters that we look at. Your ACR should be below 2.5. Your lipid targets, most of the time, will target below 2.2 or 1.8, depending. And yeah, I think we'll just leave it at that in terms of the sugar control. I hope you've learned something from this video. I'm looking forward to being of help to your health. You can access my services at Diabetes Care Center through ponea.com.